Hi everyone, Frank Spengler for ADRA Canada. As many of you have probably noticed on the news, the country of India is currently experiencing a severe crisis due to a major outbreak of COVID-19. Hospitals are overwhelmed. They have run out of PPEs and oxygen, and relatives of those who are waiting for an ICU bed are pleading over social media for the world to come to their assistance. A number of our concerned supporters across Canada have been calling our head office in Newcastle asking if ADRA Canada is responding to this crisis, if there's anything that they can do. And so I wanted to assure you today that yes, we are responding through the ADRA network, and we're receiving your tax-deductible donations to assist this emergency. And so we welcome your gifts. You can call our head office using our toll-free number, or you can go online to adra.ca and give your donation that way. I want to share with you a video that we recently received from ADRA International. Let's take a look at that interview now.
Hello, good morning, good afternoon, good evening for everybody who is chiming in around the world. Welcome to our Facebook Live with ADRA. Today we're going to be talking about the COVID-19 crisis in India, and we have two very special guests with us today. I want to welcome Weston Davis, who is our country director for ADRA in India, and we also have Trisha with us, who is our communications manager, also for ADRA in India. So welcome. And everybody who's tuning in is tuning in because we are seeing India in the headlines just all the time now, and obviously ADRA's been talking about it a lot as well. But both of you guys being there on the ground in the country, could you give us a quick introduction to what the situation is and how it might be different from what we're seeing on the news here?
The cases had subsided a lot in February, and people had thought that COVID in India is almost over. But then this second wave took people by surprise. There was this deadly mutant variant that's going around, and it's spreading very fast. A lot of people are getting infected, and our healthcare system was not ready to cope with such a large caseload, which is why people are dying. Like, preventable deaths are happening because people are not getting oxygen on time, not getting hospital beds on time, or not getting basic medicines on time. So my social media, my WhatsApp groups are filled with people asking for their relatives for leads on hospital beds, leads on oxygen cylinders, which is very sad. People are waiting outside hospitals in their makeshift cars, which they have turned into ambulances, waiting to get admitted, but they're not getting a bed. They're pleading for their relatives, but they're just losing lives outside hospitals. People are going around at night, at daytime, looking for beds in some hospital, but that's not happening. So it's very tragic what is happening. We are all trying to just stay home. The various state governments have imposed lockdowns to try and control the situation. So we are all very scared at the moment, just staying put at our homes.
Many people know someone who has perished, actually, and friends or friends of friends. And so sometimes when you do the math, you say, well, wait a minute, how is that even possible? And there's only 400 a day dying. So we know that the real numbers, there's been some experts say, whatever number you hear, multiply it times 10, and you'll be getting close.
That's
And
horrible.
and I would also like to add that even our crematoriums right now are cramped. There's no space, and even parking lots of these crematoriums, fires are being burned there, and people and loved ones are not being allowed to attend the last rites, which is very important in our religion, to pay your last respects to your relatives, and people are not able to do that, which is very sad. And even our children are badly impacted because some of the children are losing both their parents overnight, and they are being institutionalized overnight. And I just heard of a story. There was a woman who died in her home, and for 2 days the toddler lied next to the dead mother without being fed, and no neighbors came close for the fear of contracting the virus. It was two police women who found and fed the toddler, and thankfully the toddler was fine except for some fever. And these children right now are at a risk of being trafficked, of going into orphanages, and of going on the streets. So we also have to protect our children at this time.
Adding insult to injury is the lack of oxygen, both in the rural and certainly in the urban areas. No one expected this to happen, so they were caught unawares. Naturally, one of the first things when someone is under respiratory distress, they are given oxygen. Early on in the crisis, healthcare facilities, hospitals, clinics, everybody began to run out of oxygen.
Right now, because of the shortage of oxygen, we thought it would be best to get an oxygen generation plant. So that's what we are doing. We are working with the Adventist Hospital in Surat, Gujarat, to set up a plant. We have ordered one, so that should hopefully come sometime this week, and we are going to set that up.
I was talking to a healthcare professional in the US a couple days ago, and we were talking about this oxygen shortage. And he works in a hospital. He says, man, all we do is go over to the wall and plug it in. And we never, ever think about a shortage. And he says, we push oxygen to everybody. And he says, so I can't imagine what it would be like to have to be making those decisions. A friend of mine was desperately driving around the city looking for an oxygen cylinder for his friends because two of them were gravely ill with COVID. He found one and delivered it, but the family had to make a decision which person received the oxygen. And they made the decision, and the other person passed away. So think of that crisis when someone has a discussion, who shall we give this to?
Man, well, I'm very glad that ADRA is able to help in that aspect and helping with other supplies and other resources to support the hospitals and clinics there. And it sounds like you guys will be working with some of the Adventist hospitals in the country. Can you tell us a little bit about where those are and kind of some of the work they're doing? Are they focusing on COVID-19 cases mostly now?
Yes, the small mission hospitals to the larger tertiary hospitals are all benefiting from this. The hospital that will be installing our oxygen generator is a 300-bed facility located in Gujarat, and so it is a well-respected facility that will immediately benefit from this. They will not be relying on delivery of oxygen cylinders nearly at the level they would have been. An oxygen generator is a machine that is able to extract oxygen out of the air and make it medical grade. And the one that we are purchasing will be able to handle much of a large hospital. And it will deliver pure medical grade oxygen produced on site.
I want to thank Tricia and Weston, both of you again and again for your time today. I know you have a lot on your plates, and it really, really helps to make a giant headline something really personal when we're able to talk to people like you guys who are right there on the ground seeing it happen.
Thank you so much for joining us for this special episode of the ADRA Insider Podcast. If your heart has been touched and you would like to help, please go online to adra.ca, and right at the top of your screen, you'll see a red banner that's been set up to help you easily donate to this important work. You could give at your church this Sabbath, but due to the nature of this crisis situation, it's always better to give directly, either over the phone using our toll-free number or online, so that we receive your support right away and we can get your funds working in the field to help the people of India through this crisis.